And we're live on Facebook. Let's start po. Good morning, everyone. Good morning, music, and to all our media partners. Welcome to Monday's Media Forum, May 3. Joining us today is the official spokesperson of the Department of Health, the Undersecretary Maria Rosario Singh-Braheri, to give a few updates with regard to our COVID-19 response. Good morning, ma'am.
Yes, good morning Nick at magandang umaga po sa inyong lahat. Ngayong araw na ito, magbibigay lang po kami ng paunang updates before we go to our question and answer session. Can we have the slides please?
Go ahead, ma'am.
Okay, next slide please. So good morning again to all of you. So sa pagpasok po ng Mayo, nagkaroon tayo ng ilang pagbabago sa ating quarantine classification na tinatawag natin ngayon na MECQ Flex. Inaprobahan kamakailan ng IATF ang limitadong pagpasok ng mga tao sa ilang piling establishments, ngunit kinakailangan pa rin matiyak natin ang mahigpit na pagsunod sa mga minimum public health protocols natin. Next slide. Inilunsad din kamakailan last week ng Department of Labor and Employment, ng DOH, ng DILG, ng Department of Tourism at saka ng Department of Trade and Industry ang Safety Seal Certification Program, kung saan tinitiyak natin na ang isang lugar o kaya establishment ay sapat at wasto ang pagsunod sa minimum health standards set by the government and ang pag-adapt ng Stay Safe contact tracing application. Next slide. So patuloy po tayo nakakakita ng pagbaba sa growth rate at saka average daily attack rate, kung saan nakikita natin ang improvement ang national growth rate from 11% growth 3 to 4 weeks ago, naging negative 15% 2-week growth rate na tayo. Ibig sabihin po nito, kahit dumadami po ang kaso ngayon ay nakikita na rin natin ang patuloy na pagbaba, although slowly, nitong nakaraang 2 linggo. Also, the average daily attack rate shows a decrease in the recent 1 to 2 weeks with more than 7 cases for every 100,000 individuals versus a DAR of 3 to 4 weeks ago of 9.21. Particularly, dito po sa National Capital Region noong Pebrero, we were only seeing 3 cases per 100,000 population. During the peak of this surge, we were seeing 34, which is an 11-fold increase in our attack rate. We have improved currently to an average of 25 per 100,000, and while this is an improvement, this is still beyond the 7 per 100,000 threshold that we have set for high-risk classification. And this ADAR can still overwhelm the health system kung hindi po natin maiaayos ang ating response. Next slide. Kaya patuloy pa rin po ang pagpapalakas natin ng ating kapasidad for our health system sa pamamagitan ng pag-i-increase ng ating dedicated COVID-19 beds in public and private facilities. Sa kasalukuyan po, meron na po tayong 33,628 total dedicated public and private beds for COVID-19 and an additional 521 ICU beds from March 28, bringing the total number of beds to 2,849 ICU beds. Kabilang din po dito ang patuloy na pag-augment natin ng mga kinakailangan nating healthcare workers sa ating mga facilities. Patuloy naman po ang pag-i-implement natin ng travel ban. Kinakailangan po nating intindihin na ang Pilipinas ay bahagi ng global community and it is critical na maging mahusay po ang pakikipag-ugnayan natin sa ibang bansa. Ang mga bansang nasasakop po ng travel ban ay masusing pinag-aaralan, gaya na rin po ng ating mga protocol for incoming foreign nationals. At ang lahat ng ito ay nakabatay sa best and latest available evidence. Ang masusing pag-aaral at pagpapatupad ng ating policies batay sa ebidensya ay nakatuon lahat tungo sa kaligtasan ng ating bansa. Kasama po sa ating binabantayan ay ang mga COVID-19 case trends na kung inyong mapapansin ay nakikitaan na rin po ng pagbaba. Ngunit nais po nating bigyang diin na hindi po hudyat o signal ito na maaari na tayo maging pabaya sa pagsunod sa ating mga public health standards. Hindi pa rin po ito sapat para magkaroon tayo ng ganoong kumpiyansa. Bagkus dapat po lubos na pag-igtingin natin ang pagsunod natin sa mga standards na ito at ma-monitor pa rin po natin ang COVID-19 response indicators lalong-lalo na po kasama natin ang local government units upang tuloy-tuloy po nating maipababa ang ating mga trends. Next slide. Patuloy pa rin po ang pagbibigay natin ng updates patungkol sa mga pambansang pambabakuna. Ang schedule po ng pag-administer ng second dose ay alinsunod sa indicated interval ng ating mga bakuna at sa katunayan ay nakapagsimula na po tayo magbigay ng second dose ng bakuna para sa A2 and A3 priority population groups. Patuloy po ang pagkilos ng inyong gobyerno upang tiyakin ang pagdating ng mga dagdag na mga doses ng bakuna sa ating bansa hanggat sa tayo ay magkaroon ng steady supply. As of May 1, 2021, a total of 1.9 million doses of COVID-19 vaccines have already been administered either as a first or a second dose. Out of this, 1,650,318 eligible population were vaccinated already with the first dose of COVID-19 vaccine and 284,553 eligible population received their complete doses of COVID-19 vaccines. There were 1,094,493 frontline healthcare workers in the Philippines, or 70.9% of the more than 1.5 million master-listed priority group A1 population had been vaccinated as of May 1 of 2021. We continue to urge those priority groups from A1 to A3 to get in touch with your local governments para makapagpalista na po kayo at kayo po ay mabakunahan na. Next slide. Nung Sabado po, dumating na rin po ang 15,000 doses ng Sputnik V sa Pilipinas. Nais po nating linawin na ito po ay paunang batch sa 500,000 doses na darating later this month. Dahil ang unang batch ay kakaunti lamang, ititreat po natin ito bilang isang initial implementation kung saan mamomonitor po nating mabuti ang distribution, warehousing, handling, and administration ng bakunang ito because it requires a negative 18 degrees Celsius temperature. We will draw experience from this initial rollout to be able to prepare for the remaining 485,000 doses coming in before the end of May. Bukod po sa next slide, bukod po sa ating pagresponde sa COVID-19, ang Department of Health ay patuloy pa rin nagpapatupad ng ating ibang public health programs. Kasabay po ng pagdiriwang ng Road Safety Month sa buwan ng Mayo, ngayong linggo ay ang ating pag-uusapan ay ang road safety para sa mga active transport users. Ang tema para sa taong ito ay Tara, Umarangkada sa Ligtas na Kalsada for a Healthy Pilipinas, promoting active transport in the community. Hindi po lingid sa atin ang estado ng transportasyon sa ating bansa, lalo na po sa ating mga lungsod, kaya kritikal na bahagi ng ating pagsulong ng ating active transport ang pagsulong ng mataas na estado ng road safety para sa lubos po na kaligtasan ng lahat ng ating road users. So that is all. Thank you, Nick.
Maraming salamat po. Yusek, ma'am, if we can start na po with the DOH questions.
Yes.
Yes, ma'am. From the question of Donna Pasibukan of the Philippine Daily Inquirer, how is the DOH monitoring and what is the latest finding here on the efficacy of Sinovac vaccines since over 200,000 people have completed the 2 doses? Do we have data how many of them fell seriously ill or died of COVID despite the full vaccination?
Yes, actually Donna, meron tayong monitoring, no, na this is a regular monitoring, reporting and monitoring of adverse events following immunization. At pag tinignan natin out of these people who were all vaccinated with this specific vaccine, mababa lang po yung tinatala natin na adverse events following immunization or AEFI, which is about 2%, no, 2.1%. To date, wala pa ho tayong fatal events directly associated with the COVID-19 vaccines in the country. So ibig sabihin po, based on the evaluation done by our experts after this kind of serious adverse events, wala pa ho hanggang sa ngayon na nakakakita tayo o nakitaan ng experts natin that there was this direct causal relationship with the vaccines. Marami sa kanila ay coincidental lang dito po sa mga bakunang naibigay sa ating mga kababayan.
Thank you, ma'am. From the same reporter, what accounts for the reporting of numerous previously tagged recoveries as deaths, which make up about half of the daily deaths reported? Is this because of the daily time-based tagging of mass recoveries? How is the DOH addressing problematic data as a result? And how is the real death toll situation? Ma'am?
We have explained this before, no? So we tag recoveries based on the protocol that we have. So all of those mild and moderate cases and the symptomatic cases are included into our time-based recoveries kung saan kapag ikaw ay symptomatic from the time that you have your symptoms, you had your symptoms, we count 10 days, no? But before we include them as part of those being tagged, we try to verify muna dun sa ating mga implementing units if they have recovered really and if they did not die or they did not progress into serious disease. So lahat po ito ay may verification process. Ngayon, may mga pailan-ilan minsan na natag natin minsan as recovered tapos biglang magbabago po yung implementing units ng kanilang report. That's the time that we have some form of revision. But this is very, very minuscule, no? Maliit na porsyento lang kapag ka nagkakaroon ng paglilinis ng datos ang ating implementing units, they initially or they immediately inform us of these matters. So what is the true picture of the death toll? Our case fatality rate is still below 2%, although we have seen an increase in the number of deaths, no, for these past weeks. At nakita po natin na meron tayong pagtaas ng mga pagkakamatay for the month of April. And this is still because of the increase in the number of cases that we are having. So yun po ay araw-araw naman na itatala natin sa ating case bulletin and situational report where you will see the complete reports of our deaths kapag ka po tayo ay nagpa-publish na sa gabi.
Thank you, ma'am. From Sheila Chrysostom as well as from Greg, do we have a tally of how many A4 qualified individuals were given their first dose of COVID-19 vaccine so far?
We had a total of 1,718 frontline personnel in essential workers, both in the public and the private sector, na nakareceive sila nung sa initial na first dose of vaccine against COVID-19 nung Sabado. This is just an initial run of this A4 priority group. This was in commemoration of the May 1 holiday na meron tayo, which is the day for our workers. It's the Labor Day. Kaya po ito isinagawa ng ating gobyerno.
Thank you, ma'am. Still from Greg Gregorio, are we now going to simultaneously inoculate A4 with the ongoing inoculation of A1 to A3?
Ay, hindi pa, Greg. As I've said, it was just something of a symbolic event para lang i-recognize natin ang value ng ating mga manggagawa at maipakita rin po natin na talagang sila po ay kasama sa priorities ng ating gobyerno. Sa ngayon po, hindi pa ho natin sila isasama. Aantayin pa natin ang mga karagdagang mga bakuna na parating by May and by June so that we can simultaneously start also. Makasama na sila dun sa simultaneous vaccinations from A1, A2, A3, and then them A4.
Thank you, ma'am. From Jessel Ricafort of DCRH News, kamusta na po ang information drive sa bakuna ng DOH? In a statement yesterday, Senator Lacson warned of the possibility that the vaccines once available in the Philippines may just be wasted dahil sa low trust ng mga Pinoy sa vaccination. The DOH comment po, ma'am.
Yes, actually, marami na tayong nakukuha ng mga reports, no, and even observations, no, ng ating mga kasama and mga tao natin on the ground that the confidence have increased actually comparing to the start that talagang nakita natin na maraming hesitant. Ngayon po, according to our hospital chiefs, yun po mga nag-refuse natin ng mga healthcare workers before are now informing them that they want to get vaccinated already. Also in the community, no, nakita natin na hanggat nakikita nila na ang healthcare workers natin na bakunahan na at ang iba pa nilang mga kapitbahay na bakunahan, nagkakaroon po ng domino effect. So we are seeing now that the confidence is increasing, kaya nga po gusto natin talagang mapabilis at saka mapalawak na ang pagbabakuna natin to take that opportunity for people, no, to get vaccinated immediately.
Thank you, ma'am. From some of our media partners are asking from Caroline po, did the DOH already forward reports on ivermectin for investigation? From Lay, an update daw po on the FDA investigation of last week's ivermectin distribution where token prescriptions were also issued. Yusek?
Yes, Lay and Red, no? Lahat iniimbestigahan pa. nakapagpadala na po tayo ng formal letter to the Professional Regulatory Commission last Friday, and they already have acknowledged this. Ito po ay nagbigay tayo ng mga anecdotes at saka alleged na mga nireport sa atin about the invalid prescription, no? And of course, we like to also know from them the practice of profession, no, nitong mga sumali dito na mga healthcare workers natin who are licensed by PRT. The Secretary of Health also have given that instruction to the FDA last Friday to do that parallel investigation as well. So pinag-aaralan yan ngayon, nag-iimbestiga, magbibigay tayo ng information kapag meron na silang binigay sa atin na response.
Thank you, ma'am. From Paul Adrian Samarita, in another topic po today, ang rollout ng Sputnik V vaccine sa 5 cities in NCR. Meron na po bang schedule at list of hospitals na makaka-receive nito given its requirement and storage? And what are the plans po for the trial batch of Sputnik vaccines? Na-inspect na po ba if the quality was maintained during shipment?
Yes. Okay. Yung 5 sites, for Makati, it's Makati Coliseum. For Taguig, it's Lakeshore Vaccination Hub. For Parañaque, it's Ayala Mall, Manila Bay. For Manila, it's Santa Ana Hospital and Hospital ng Maynila. And for Muntinlupa, yung Hospital ng Muntinlupa at saka Asian Hospital. So kailangan natin maintindihan. Kaya po natin sinasabi na initial implementation because this is the first time that the country is going to receive a vaccine with a different storage requirement. Kung matatandaan po natin, ang Sinovac at saka AstraZeneca, ang kanilang requirement, yung temperature requirement for storage was just at 2 to 8 degrees, no? So pero ito, ang requirement niya is -18. And even in the past years, when we were handling vaccines, its storage and its distribution, hindi po tayo pa nakakaroon ng experience na ganitong klase na requirement ng temperature. That's why we call it initial implementation because we would like that we can see how we are going to manage it properly, to store it properly, and to distribute properly. So ngayon po, ito pong mapapauna natin na 5 sites, titignan natin yung experience natin dyan. At kung meron tayong kailangang i-improve po natin. But definitely, the vaccines will already be given to our constituents or citizens because nabigyan naman na po yan ng EUA ng ating FDA at ginarantisado na rin naman na it's safe and efficacious and it's going to protect our population. So yun po yung ating gagawin, titignan natin yung how do we do these storage conditions. Ngayon, yung tinatanong mo kung pagdating dito maayos yan, yes, we do not receive vaccines na nagkaroon ng mga issues no while being transported or while being stored going here. So ang initial na ginagawa ng ating logistics team, kaya sinasalubong natin lagi sa airport, di ba? Yung mga bakuna, tinitignan na ho natin yung temperature nila. Meron tayong monitoring ng temperature para makita natin yung temperature niya upon arrival. Tapos pag nilipat na siya dun sa carrier natin or transport system, i-check natin uli. Kasi i-check po natin uli pagdating dun sa warehouse natin. So we check it regularly so that we are sure, no? We are ensured that the potency of the vaccine is maintained while we transport and store them.
Thank you, ma'am. From Job Manahan, quickly lang po, Yusek, if we can clarify if the 15,000 doses of Sputnik V vaccine were ordered or donated po.
These were procured.
Yes, ma'am. Thank you po. From Red Mendoza, a Filipina data scientist from Australia has developed an application called COVID-19 app kung saan pwedeng makita ng public yung graphical representation ng hospital capacity across the country. It looks like na siya pa lang ang gumagawa nitong application na ito, and she adds na she's willing to help with the DOH to expand the application to include more real-time data on hospitals instead of the data drop. Would the DOH offer help po to the developer?
Of course, of course. They just need to coordinate with us. They just need to send us their initial work so that we can try and check because we have an existing program already that we are using. And if it's going to be of value at makakadagdag po dun sa ating capacity, and then very well appreciated po yan. They just need to coordinate with us so that we can work with them.
Thank you, ma'am. From Paul Adrian Samarita, meron na po bang naitalang kaso ng B.1.617 variant from India? Malaysia just reported its first case of the Indian variant from an Indian national that was screened in Kuala Lumpur International Airport.
Sa ngayon, wala pa, no? Even last week when we tried evaluating again all of these processed samples, wala pa ho tayong na-identify na B.1.617 variant dito sa ating bansa. Kaya nga po, we are trying to strengthen our border control implementation para ma-avoid po natin ito mangyari sa atin.
Thank you, ma'am. In relation to that, meron na din po bang suspected individuals na tinitingnan natin na baka po maging carrier ng nasabing variant?
Wala, meron tayong mga may mga dumating sa atin katulad ng nabanggit namin sa inyo nung isang linggo na merong mga pasahero na either meron silang touch point doon sa India, nag-pass through sila or galing sila talaga doon and they are currently quarantined. So tinitignan natin itong mga to. Once may mag-positive sa sample sila, we are going to subject this to the whole genome sequencing process.
Thank you, ma'am. From Lay Alves of GMA News, may grupo ng mga senior citizens ang humihiling umano na luwagan na ang restrictions sa kanila dahil marami na raw sa kanila ang vaccinated. Ano po ang posisyon ng Department of Health dito?
Gusto ko namin magpaalala, no, not just for senior citizens, but for everybody who received their vaccines, especially those who are completely vaccinated already. Kailangan po natin tandaan, it takes time bago po mag-kick in at tumaas ang antibodies natin sa katawan and to say that we have that protection. But kahit po tayo magkaroon na nitong sinasabing protection from the vaccine, we still advise our citizens who are vaccinated to do the comply still with the minimum public health protocols. Tandaan po natin, hindi po assurance na kayo ay nabakunahan na hindi na po kayo magkakasakit, no? These vaccines do not have that capacity to block transmission. So ibig sabihin, pwede ka pang mahawa at pwede ka pa rin makapanghawa. Ang pinangako po sa atin ng mga bakunang ito is that we will have less chances of having severe infections, less chances of being hospitalized, and less chances of dying. So kailangan pa rin po tayo lahat mag-ingat at lalong-lalo na ngayong mataas ang mga kaso, sana po ang ating mga nakakatanda ay manatili muna sa bahay kahit kayo po ay completely vaccinated.
Thank you, ma'am, for the reminder. From Jessel Ricafort of TCRH News, any updates po sa implementing rules and guidelines ng ating indemnification fund? May sinusundan po ba tayong deadline? Kailan po target itong ilalabas?
Actually, itong indemnification fund, no, at saka itong batas para dito, inaayos na po yung mga implementing rules and regulations. And part of this would be the indemnification details where PhilHealth is the one who's going to manage and develop this package. So antayin lang po natin, ito po ay pinoproseso na, pinag-aaralan, maglalabas po tayo ng information in the coming days.
Thank you, Yusek. Those are all the questions that were submitted this morning. May mga pahabol po tayo from the chat, Yusek. I'll go through the question of Jerome Morales. Secretary Duque said on Friday that an India-like COVID surge is a big possibility if minimum health standards are not followed and if the pandemic response is not intensified. How near or far are we in terms of being India-like in case surges? What concrete steps have we taken to prevent this, especially since a new variant was reported in India?
Yes, Jerome, no? So yung sinasabi ni Secretary, it's just a warning, no? It's just something that he wants people to be cautious kasi pag tinignan po natin yung nangyayari ngayon sa India, it's happening also actually across the globe and even here in the Philippines. Yung intensity lang talaga ang medyo nagkakaiba-iba. So pag tinignan ho natin, yung mix of factors why increase in cases are happening is the same across the whole globe, no, sa iba't ibang bansa. Ngayon, ang sinasabi natin, posible yan, no, na mangyayari dito kung hindi tayo mag-i-intensify ng response. Pero katulad ng nakita natin, we have our peak of this increase in the number of cases first week of April. At unti-unti naman ay napapalakas natin ang ating health system, nakapagdagdag tayo ng mga beds, nakapag-ayos tayo ng ating mga healthcare referral system. And most importantly, we are intensifying our response on the ground. Yan ang pinaka-importante, no? Na ang local governments natin, katulong natin ngayon para ma-strengthen natin yung PDITR natin, especially on the part of detecting, isolating, and treating. Dahil sinasabi ng mga eksperto natin, isa sa mga critical na kailangan nating pagtuunan ng pansin is shortening that time when a person is identified to the time that a person is isolated para maputol natin ang transmission. So ito na po yung mga nagagawa natin sa ngayon. How far are we from what's happening there? hindi po natin yan ma-measure, no? I guess it's not really comparable, no? Especially population-wise at saka setting-wise. Pero tayo ngayon, nag-iigting talaga tayo sa ating response, especially now na meron na ho tayong nire-revisa and hopefully na ma-approve na agad ng mga border controls natin to prevent further ito pong pagpasok ng mga ganitong variants sa ating bansa.
Thank you, Yusek. From Paul Samarita, TV5 News, Okta released its latest bulletin stating that NCR's average daily cases plummets to 3,144 for the past 7 days, an 18% decrease compared to last week and 43% lower compared to the peak average of 5,551. Apart from that, Okta says that NCR's R naught is now at 0.83. With that in mind, are we in the recovery stage right now? And what does it mean? And are we indeed going to see a downtrend of cases in the coming weeks?
Unang-una, no, yung binigay na datos ng Okta, tama po yan. Ano? Nakikita na natin talaga yung pagbaba ng mga kaso. Pero katulad nga ng lagi naming sinasabi, it's not just the numbers that we look at. No? Hindi lang po yung mga kaso ang tinitignan natin. Titignan din po natin kasabay niyan yung ating healthcare system. So sa pagbaba ng kaso, sana may kasabay din na pag-decongest o pagbaba ng mga kaso na na-admit natin sa ospital. Nakakakita na ho tayo ng downward trend sa ating admissions. Nakakakita rin tayo ng pagluwag doon sa ating mga ospital. But these are not significant yet. No? So this is not for us, all of us to be complacent at this point. Tuloy-tuloy po nating bantayan itong pagbaba ng kaso and hopefully it becomes significant when we try to look at the healthcare system also. So tignan ho natin in the coming weeks kung patuloy na bababa, pati yung ating hospital capacity ay magkaroon na ng pagluwag para masabi na natin talaga that we are on to that direction of having this kind of decline in the number of cases.
Thank you, ma'am. From Sheila Crisostomo, ano po ang mga contraindications ng Sputnik V vaccines? Saang LGUs and anong priority group ibibigay ang 15K doses of Sputnik V vaccines? Based sa announcement ng Parañaque, it will be given to A1 and A3 groups aged 18 to 59.
Ganun din ang Sputnik V, no? It's 18 to 59 years old. Ibibigay pa rin natin siya dun sa priority population natin, Sheila. No? So hindi pa rin tayo nag-iiba ng ating priority population natin. So ngayon, ibibigay natin muna siya dun sa A1 na mga hindi pa natin nabakunahan at saka dun sa A3 na may comorbidity. So yan muna ang paunang bibigyan ng ating 5 mga lungsod dito po sa pagbibigay ng Sputnik V.
Thank you, ma'am. From Catherine Gonzalez, gaano kababa po dapat ang bilang ng new active cases per day at ang healthcare utilization rate bago ma-consider ang pag-implement muli ng GCQ sa NCR+?
Well, we have parameters, no? Pag sinabi natin na healthcare system capacity, kailangan tayo ay nasa low risk, kumbaga para tayo ay GCQ. So ibig sabihin, ang healthcare utilization mo dapat na andun ka lang sa mga less than 50% para masabi mo that we have a low risk for this healthcare capacity. When we talk about naman ng mga kaso, meron tayong sinasabing average daily attack rate. Kailangan ito ay 7 or less para masabi nating low risk tayo. And for the 2-week growth rate, kailangan makita natin na meron tayong negative growth, no, or less than nung sinasabi natin from the previous 3 to 4 weeks. So these are the parameters that we use for us to say that we can escalate or de-escalate. But what would be most important also for us to be able to de-escalate, aside from the number of cases, we need to look at the gatekeeping indicators. Ito po yung mga indicators na ginagamit natin for local governments on prevention, detection, isolation, treatment, and reintegration. Kailangan makita natin may capacity na rin yung local governments natin at na i-achieve nila yung mga indicators, yung targeted na mga numero natin for those indicators para masabi natin na kahit na mag-shift tayo sa lower classification at biglang tumaas uli ang kaso, we can manage it because they have that capacity.
Ma'am, from just to clarify lang daw po, Yusek, you said daw po that the increase in case fatality rate is due to the rise in cases. Has it something to do with the capacity or capability of hospitals to take care of patients, or is it because there are evidence that the new variants are more virulent?
Sheila, there is no evidence that the new variants can cause severe disease. No, that's one. Wala pang sufficient na evidence to say that. Although there would be articles having this kind of statements, pero wala pa talagang totoong ebidensya that they can cause more severe disease and lead to death. Pangalawa, as the numbers rise, expectedly dumadami talaga ang mga namamatay, no? So yun po ay isang trend na na-experience naman ng marami, ano? So itong sinasabi natin na walang kapasidad for management, I think no. Pag tinignan ho natin how we manage our cases now compared to the initial, napakagagaling na po ng ating mga doktor at ospital ngayon to manage COVID cases. They have already been able to save a lot of people, no, from dying from this disease kasi learned na tayo lahat, no, doon sa mga lumabas na mga clinical pathways na ginagamit, sa mga gamot na sinusubukan at sa mga suporta, no, na nakukuha nila for the different hospitals. So I don't think that it's because we don't manage them well. Isa kasing problema dyan is the health-seeking behavior, that when our citizens go to the hospital, it's either they are really at that stage na talagang critical na, no? So that can also mean something when it comes to death. So lahat ito, maraming factors na kino-consider when it comes to deaths. But generally, we can say because the cases have increased and so the deaths are increasing also.
Thank you, ma'am. From Caroline Bongkin, saan po ang tinitingnan na possible storage sites for the remaining Sputnik doses?
We have a storage site, no, which is equipped for this kind of temperature, no. So dito po sa ating storage warehouse ngayon, equipped naman po 'yan. Now for these different hospitals or different areas that we have identified, meron silang kani-kanila, no, na nagkaroon na talaga sila ng storage na pinaghandaan nila itong mga -18 or -20 kapag dating ng ibang bakuna. So meron din po sila. So we are equipped with this, but of course, we will still need the help of our private sector. Lalong-lalo na kung marami na pong doses ang darating, hihingi na tayo ng tulong dito sa ating mga private sector na namapa na rin naman natin na meron silang kapasidad para dito.
Thank you, ma'am. From Dante Amento of UNTV, during the consultation with healthcare workers groups, ano-ano pong mga benefit ang hindi rin daw po na ibibigay sa mga health worker? Budget has been downloaded. Yusek.
Again, Nick,
during the consultation, sorry ma'am. I'll repeat the question po. During the consultation with healthcare workers groups, ano-ano pong mga benefit ang hindi pa rin daw po na ibibigay sa mga health workers?
Hindi pa na ibibigay.
Yes,
so,
ma'am.
yung sa mga napag-usapan, katulad noong mga hazard pay, yung mga SRA, nakapagbaba po tayo ng pera immediately, no, nung pagkatapos makipag-usap ni Secretary of Health dun sa mga alliance of healthcare workers, no, at nabayaran natin at naibigay natin sa mga facilities yung mga dapat ibayad sa healthcare workers hanggang sa dulo ng December of 2020. Isa yan sa kanilang mga complaints dahil may mga healthcare workers na hanggang sa ngayon hindi pa nakukumpleto yung kanilang mga benepisyo nung last year pa, no, nung December 2020. So isa yan sa talagang ginawa immediately ng Department of Health, naghanap ng pondo at ibinabayan para makumpleto yung kanilang mga benepisyo na hinihingi sa atin.
Thank you, ma'am. From Aiko Miguelo, follow-up po. The additional doses of Sputnik V that will arrive will be used in po ba in NCR, considering the temperature requirement? If meron po i-deliver sa province, how will it be delivered in other provinces capable of storing it?
Well, we have we have different strategies to do that, Aiko. Meron naman po tayong mga storage facilities na may ganitong kakayanan doon sa mga major natin na mga regions na urbanized, katulad ng Davao, ng Cebu, katulad I think in Region 4A, Region 3, and Region 6. Meron po tayong mga ganyan. Meron po tayong kausap na ng mga logistical firms kung saan they have that capacity to transport this kind of vaccine. So antayin po natin dumating, inaayos po ng vaccine cluster natin yung rational na storage and distribution process natin, especially for this type of vaccines. But what we can assure you is we have the capacity to do this.
Ma'am, from Red Mendoza, pwede po pa-clarify lang po yung advisory on aspirin and COVID-19? And also, how can people be able to verify fake news such as COVID being bacterial? Yusek?
Yung COVID being bacterial, it's all over, no? It's all over the different publications, evidences, scientific journals that COVID is viral. So nakikita ho natin, kaya nga yung pangalan niya, di ba, SARS-CoV-2, yun pong COVID-19. It's a virus and we have evidence to support that. Ang atin pong mga kababayan ay maaari lang pong mag-log on sa website ng DOH. You'd find the different publications there. Kahit po dun sa mga iba pang mga credible at saka reputable na mga journals of medicine, you'd find it there. That is really coming from a viral source. Yung second na question, Nick, can you repeat it again?
Ma'am, yung advisory daw po regarding aspirin and COVID-19, kasi may nagsisirculate po USEC na doctor po na sinasabi po na yung aspirin daw po ay nakakapag-increase ng risk of COVID-19.
Wala pa ho tayong natatanggap na ganitong rekomendasyon galing sa ating mga eksperto. Maaari po, no, kung sakali tinitignan natin, meron ho kasing mga ibang mga COVID-19 critical cases that goes through this complications, no, na nagkakaroon po na minsan yung sinatawag na pagdugo, no, or yung DIC. Pero at the early onset, I don't think so. There are no other publications or evidences na lumalabas po ngayon na sinasabing ang aspirin is contraindicated for COVID-19. At wala pa rin hong binibigay ang ating mga eksperto na ganyang rekomendasyon.
Red, meron din fake news na social media card yan on Facebook. Yusek, next question po from Gerard Anthony Naval. Representative Defensor has asked the DOH not to run after the doctors that gave out ivermectin prescriptions, and it should be them that should be held liable if there are any wrongdoings. What is your response to this, and are we looking into the possible liabilities of the lawmakers behind the ivermectin pantry?
Well, we will act accordingly, according to the existing laws that we have in the country, according to the identified violations, according to the accountable person. So yun po gagawin namin. We are on to that position and direction na i-uphold namin kung ano sinasabi sa batas at gagawin po namin yan.
Ma'am, from Caroline, Dr. Solante said that the Philippines must strengthen protocols on enclosed spaces to prevent a surge like in India. Ano pa po ba ang pwedeng i-adjust sa protocol sa enclosed spaces po?
Well, Caroline, maraming factors pa rin yan. No? It's not just to say that you are in an enclosed space, anong gagawin natin. Ano? Naandyan pa rin yung factor, gaano ba kalaki ang enclosed space na yan, gaano ba kalawak, at saka meron ka ba talagang ventilation na pwede dyan sa enclosed space na yan. At saka ang pinaka-importante, gaano ba kadami yung mga taong pumapasok sa enclosed space na yan. So all of these factors would come into play kapag tinitignan ho natin how we can prevent that. Unang-una, ang atin laging sinasabi sa ating mga kababayan, huwag na muna tayong pumunta sa mga enclosed spaces kung maaari at maiiwasan. Pangalawa, ang mga establishments naman at workplaces, for them to be able to prevent transmission within their areas, dapat meron tayong fina-follow na standards for ventilation. At ito po ay nakasaad lahat dun sa sinasabi nating safety seal requirements. That's why we use the safety seal requirements as a determinant kung pwede nang magbukas at gaano ang pagbubukas ng isang establishment or workplace based on how they can comply with the standards. At isa po sa pinaka-importante na standard dyan sa safety seal, yung ventilation requirements. So when we say that it's an enclosed space, kailangan po natin yung mga factors may consider natin. Ilang tao ang nasa loob, gaano yung kanilang filtration or ventilation mechanisms, and of course the space, no, nung enclosed na spasyo na yan. So ang laging sinasabi ng mga eksperto, the best pa rin, open the windows and the doors para may in and outgress ng air, no, may flow ang ibig sabihin. Kung wala, meron na ho tayo mga specific na mechanisms na inirekomenda base sa standards na ibinigay natin sa mga establishments.
Ma'am, still from Caroline lang po, if you have this data lang po, ma'am, may study po ba kung ilang percent ng establishments ang compliance sa standards sa ventilation requirement?
Ito po ay isa sa gagawin ng DOLE at saka ng DTI kung saan magkakaroon po ng baseline monitoring so that we can have a baseline of all of these establishments at masasabi natin at matatrack natin and to monitor them, especially that we are now enforcing itong safety seal requirements na ito.
Ma'am, from Jenna Balaoro, a clarification po. Naitag daw po ba yung nagsabi na sa 18 to 59 years old lang po ibibigay ang Sputnik?
It's the indication na was given to FDA, no? So ang NITAG po, kapag nagbigay ng indikasyon ng FDA through the Emergency Use Authority, yan po yung ina-adapt natin. Hindi tayo magbabago dyan, not unless there are specific na kailangan pag-aralan na pwede po natin na masabi based on evidence na existing na pwede namang gamitin sa iba. Pero sa ngayon, ito po ay galing sa Food and Drug Administration.
Maraming salamat po, Yusek. I think on that note, we can end the briefing. Ma'am, if you have any reminders po before we end today's briefing.
Yes, thank you, Nick. So bago po tayo matapos dito po sa ating media forum, gusto lang namin po kayong bigyan ng mga sumusunod na paalala. No? Ngayong ang priority groups A2 and A3 ay nagsisimula ng makakuha ng kanilang second dose ng bakuna laban sa COVID-19. Una, ang mga bakuna po na meron tayo ngayon ay hindi nakakapagdulot ng COVID-19. Ang mga bakunang ginagamit ngayon sa bansa ay gumagamit po sila ng tinatawag na inactivated na viral platform. Ibig sabihin po nito, patay na po ang virus na nilagay sa inyong katawan at hindi na po maaari pang makapagdulot ng COVID-19. Ang Food and Drug Administration ay nagbibigay ng Emergency Use Authority na nagpapakita na itong mga bakunang ito ay ligtas at saka epektibo base sa mga datos na kanilang pinag-aralan. Pangalawa, may panahon po bago makaipon ng resistensya ang ating katawan laban sa COVID-19. Ang proteksyon po na ibinibigay ng una at pangalawang dose ay hindi agad-agaran dahil kailangan pa ho ng panahon bago makaipon ng antibodies laban sa COVID-19 ng ating katawan. Kapag ikaw ay nabakunahan ng Oxford AstraZeneca, meron pong 12 linggo bago ka mabigyan ng second dose. Para naman po sa Sinovac Coronavac, meron pong 28 days or 4 na linggo bago ka makakuha ng iyong second dose. Matapos po ang second dose, kinakailangan pa ho ng mga 2 linggo hanggang 3 linggo bago po kayo maprotektahan laban sa malalang uri ng COVID-19. Pangatlo, kumpletohin po natin ang second dose ng bakuna. Ang Coronavac at AstraZeneca ay kinakailangan po ng pangalawang dose. Ang hindi pagkumpleto sa pangalawang dose ay hindi magbibigay ng kumpletong proteksyon laban sa COVID-19. So upang maiwasan ang malalang uri ng COVID-19 at kayo ay maospital, kumpletohin po natin ang doses na ibinigay sa atin ng local government sa takdang araw na sinabi nila base po dun sa kanilang mga paalala. And lastly, patuloy po tayong sumunod sa minimum public health standards kahit po tayo ay nabakunahan na. Ang mga bakuna ay nakakaprotekta laban sa malalang uri ng COVID-19 at maari pa rin po tayo makakuha ng COVID-19 at makapanghawa ng ibang tao kahit tayo ay bakunado na. Kaya kinakailangan pa rin po natin magsuot ng face mask at face shield, palagi ang mag-ugas ng kamay, mag-physical distancing, siguraduhin po na sa open spaces tayo pumupunta hanggat sa maaari at ang pag-iwas po sa madamihang tao kapag tayo ay lumalabas. Sa paggawa po natin ito, mapapababa po natin ang transmission ng COVID-19, mapoprotektahan po natin ang ating sarili, ang ating pong mga kapamilya at ang ating community. So thank you very much to all of you. Maraming salamat and good morning and thank you, Nick.
Maraming salamat po, Yusek, and to all of